I just want to talk about medication side effects. Medications always have a risk of side effects, and some people tend to be affected differently. Some people will get very severe side effects, other people will just get very minor side effects, and some people will get none at all. In fact, usually most people will get either none at all or just very minor side effects. Now this has come about because sometimes people make a really big deal about side effects. You'll end up with, say, one person who has very severe side effects, whereas the vast majority of them have only very minor side effects, and it's that one case of the severe side effects that puts people off a medication. Anyway, I just wanted to go through this leaflet here. This leaflet is from Sertraline, which is a selective serotonin reuptake inhibitor. I got this leaflet some years back. I've not had Sertraline for a long time. It didn't work very well for me, and I had side effects which I didn't get on with. But this leaflet is actually really quite entertaining to read. Let's see what side effects Sertraline has, or at least can have. It says nausea is the most common side effect. Tell your doctor immediately. That's severe skin rash, allergic reaction or allergy, which may include itchy skin rash, breathing problems, wheezing, swollen eyelids, face or lips, agitation, confusion, diarrhea, high temperature, high blood pressure, excessive sweating, rapid heartbeat. These are symptoms of serotonin syndrome. Yellow skin and eyes, which may mean liver damage. Depressive symptoms such as harming or killing yourself. That's always a bit of an unusual one because with antidepressants you expect it to fix that problem, whereas sometimes it actually makes it worse. Restlessness, seizures, manic episodes, and the next lot, they're the very severe things that you should think about, but the next ones are really quite interesting to read. This is actually written in a way that makes the drug sound it's written in a way that makes it sound like an absolutely terrible drug, whereas in reality it's nowhere near as bad as it makes it out to be. So the very common side effects, which will affect most people who take it: insomnia, dizziness, sleepiness, headache, diarrhea, feeling sick, dry mouth, ejaculation failure and fatigue. Then ones that fewer people will have but still quite a lot: sore throat, anorexia, increased appetite, depression, feeling strange, nightmare, anxiety, agitation, nervousness, decreased sexual interest, and teeth grinding. Numbness and tingling, shaking, muscle tense, abnormal taste, lack of attention, visual disturbance, ringing in ears. Palpitations, hot flush, yawning, abdominal pain, vomiting, constipation, upset stomach, gas, rash, increased sweating, muscle pain, sexual dysfunction, erectile dysfunction, and chest pain. Then we've got the even less common ones: chest cold, runny nose, hallucination, feeling too happy, lack of caring, thinking abnormal, convulsion, involuntary muscle contractions, abnormal coordination, moving a lot, amnesia, decreased feeling, speech disorder, dizziness while standing up, migraine. Ear pain, fast heartbeat, high blood pressure, flushing, breathing difficulty, possible wheezing, shortness of breath, nosebleed, inflammation of the esophagus, difficulty swallowing, haemorrhoids, increased saliva, tongue disorder, and burping. eye swelling, purple spots on skin, hair loss, cold sweat, dry skin, hives, osteoarthritis, muscle weakness, back pain, muscle twitching, nighttime urination, unable to urinate, increase in urination, increase in frequency of urination, and problem urinating. Vaginal hemorrhage, female sexual dysfunction, malaise, chills, fever, weakness, thirst, weight decreased, weight increased. Now the rare side effects, which hopefully you won't get, but clearly some people have. Intestine problem, ear infection, cancer, swollen glands, high cholesterol, low blood sugar, physical symptoms due to stress or emotions, drug dependence, psychotic disorder, aggression, paranoia, suicidal thoughts, sleepwalking, premature ejaculation, coma, abnormal movements, difficulty moving, increased sensation, sensory disturbance, glaucoma, tear problem, spots in front of eyes, double vision, light hurts eyes, blood in eye, enlarged pupils, heart attack, slow heartbeat, heart problem, poor circulation of arms and legs, closing up of throat, breathing fast, breathing slow, difficulty talking, hiccups, blood in stool, sore mouth, tongue ulceration, tooth disorder, tongue problem, mouth ulceration, problems with liver function, skin problem with blisters, hair rash, hair texture abnormal, skin odour abnormal, bone disorder, decreased urination, urinary incontinence, urinary hesitation, excessive vaginal bleeding, dry vaginal area, red painful penis and foreskin, genital discharge, prolonged erection, breast discharge. There's more, got to move to the other side. Hernia, injection site scarring, drug tolerance decreased, difficulty walking, abnormal laboratory tests, semen abnormal, injury, relaxation of blood vessels procedure. Cases of suicidal ideation and suicidal behaviours have been reported during sertraline therapy or early after treatment discontinuation. Other things that have been reported: decrease in white blood cells, decrease in clotting cells, low thyroid hormones, endocrine problem, low blood salt, terrifying abnormal dreams, suicidal behaviour, muscular movement problems such as moving a lot, tense muscles and difficulty walking, passing out, vision abnormal, bleeding problems such as nosebleed, stomach bleeding or blood in urine, pancreatitis, serious liver function problems, yellow skin and eyes, skin edema, skin reaction to sun, itching, joint pain, muscle cramps, breast enlargement, menstrual irregularities, swelling in legs, problems with clotting, bedwetting, and severe allergic reaction. That was a bit of a mouthful, but they've made this sound incredibly bad, and it seems like they've listed just about every side effect in existence. In fact, not side effect, every single symptom in existence they seem to have listed in this leaflet. And I suspect what's happened is a lot of these are things that that people who took the drug during clinical trials would have suffered, and quite possibly they aren't anything to do with the drug. It might just be things that, if someone dies during a clinical trial, it doesn't mean that the drug that they were testing killed them, it just means that they died while they were on the clinical trial. Some of these are really strange. Here they list injury as being a possible side effect of the drug. What sort of injury? Could they be more specific? And there's even more vague ones. Which one was I looking for? Yeah, this one here is a really strange one. Tongue disorder. What is a tongue disorder? And there's a lot of duplication as well. We've just had the tongue disorder, but if you move further down, there's tongue problem. I wonder what's the difference between a tongue disorder and a tongue problem. The tongue problem is a rare side effect, but the tongue disorder is an uncommon side effect. But we also have here tooth disorder. What is a tooth disorder? And did the person who suffered a tooth disorder, did they actually get a tooth disorder because they took sertraline, or did they just have long-standing dental problems? Anyway, I think it's safe to say that sertraline, even though it didn't work for me and did cause side effects, it's certainly nowhere near as bad as they make it out to be in the leaflet. And the enormous list of potential side effects really shouldn't really put anyone off taking any kind of medication. But I just thought I'd show this because that list of side effects is really quite amusing to read. Most drug leaflets, they don't have them anywhere near as long as that.